The season of health and wellness is on Cruise Through HTX. My name is Freddie Cruz, and today I'm bringing my friend Peter Remington to the show. Once upon a time, he used to be my boss's boss. The guy runs with the Bulls in Spain every year. Yes, he runs with the Bulls. Actual Bulls. He also happens to be a Medicare broker. That's why he's on this episode. In fact, today we're going to cover navigating the sea of Medicare options at age 65, the importance of signing up for Medicare Part B to avoid lifelong penalties, how brokers can help you choose the best plan tailored to your needs, and so much more. If you enjoy this episode as much as I did putting it together for you, please consider sharing and subscribing to my podcast at cruisethroughhtx.com. And last of all, please talk to your primary care physician before trying anything you hear during any of the episodes on this season of Cruise Through HTX. Peter, what do we need to know about Medicare?
Wow.
Do I have 5 hours? Yes. No, I'm just kidding.
There's a lot to know about Medicare. I mean, it's funny. People grow up, and I was part of this, and everybody's been a part of this. You get your first car, you get on your dad's car insurance. You're also on your dad's health insurance as a kid. You're on your dad's health insurance until you're about 26 years of age, but then you get a job. When you get a job, you get on your job's health insurance. So when you're on your job's health insurance, you pay your premium as some money's coming out of your paycheck, and the company pays for a little bit, and you pay for a little bit, and then you also have your deductibles. And every year they change, right? It goes from Blue Cross Blue Shield to also United Healthcare to something else because they're trying to save money. The company's a way for them to save money.
And it's hard to keep track of.
It's hard to keep, but you don't have to because you have your business manager, your human resource person doing all this work for you and coming into the big conference room and telling you what the new insurance plan is going to be for that particular year. Well, then you keep on going and going, and then all of a sudden you get slapped in the face with the age of 65. And you are now eligible for this thing called Medicare.
That is where your money goes when you're 16. You're like, what the hell is this? I thought I was making $200 flipping burgers.
Right. Well, you have to pay a little bit towards your Medicare.
Paying a little bit toward, right.
Yeah. But all of a sudden, you're at Medicare, and let's say you retire, or even if you're still with your company because you're a human resource person or your business manager, whoever may be taking care of it, doesn't know anything about Medicare. So all of a sudden, as an individual, you're out there in the sea of Medicare, paddling away with waves splashing over your boat, saying, buy me, do this, do that. Do I have a supplemental plan? Do I have an advantage plan? What about my prescription drug plan? When do I have to sign up? Is it a plan G? Is it a plan F? All these different things are coming at you like crazy.
He's making me dizzy.
Don't drink the water from the ocean. You'll drown.
Goodness.
The point being is that it is a complete crazy bit of information that you get.
Yeah.
You know, I have clients, with Remington Insurance Brokers, I have clients that never signed up for their Part B. I mean, there's so much to discuss about this, but they forget to sign up for their Part B because nobody tells you to sign up for your Part B. Ooh. And if you don't sign up for your Part B, there's a penalty. And it's a penalty, not just a one-time penalty. It's a penalty that follows you for the rest of your life that you're on Medicare.
No way. You got that scarlet letter on you, huh?
You got that right.
Wow.
Yeah, it says B for Part B. But anyway, Medicare, just so you know and your audience knows and everything, is the best thing that will ever happen to you. I mean, it's great insurance. It's you get to see the doctors you want to see. You get to see the doctors as often as you want to see. And it's not anything like you experienced under your corporation when you had a huge deductible, be it $500 or $1,000, or in some cases $1,500 deductible. And the worst case being is that they change it every year. So then all of a sudden you have to change your primary care physician, known as your PCP.
Yeah.
You have all that going on. So when you get to the age of 65, Medicare is cool. When I sign up a client, When I sign up a client, look at me, I get excited about this.
He is lit up right now. He's glowing. You might not see it on camera, but I see it in person. He's glowing.
I get excited about this because, A, I know I'm helping somebody with one of the worst possible experiences they could possibly go through, which is called signing up for Medicare. And when it's all said and done, I tell them all the things I just said. That's the best thing that ever happened to them. And when they get their Part B and they sign up for their Part B and I get them involved in a plan, and I said, now you're part of the cool kids. You're now one of the cool kids because you're in the plan. You have all these great things going on. I signed up an individual just yesterday, and I said, now that you have it, and he had good insurance with his company. I said, now that you have it, use it. You have $0 copays to see your primary care physician. Get everything checked out, blood, this, that, the next thing. It's really a great opportunity for people to do a checkup on themselves at the age of 65.
When you say that it's one of the worst things ever, is it because there's so much information, people get overwhelmed by it? Listen, you're excited about talking about this, and I imagine that the average person is just, they see it, they're like, oh.
Right. And first of all, I want to let everybody know that I'm normal. Okay.
He only runs with the bulls, but outside of that, he's completely normal.
But I'm pretty much normal. I have another company where I do coaching. I do life coaching. I've been behavioral change coaching. I write books and do speeches and all that. But because this falls in the same category of helping people, I love it.
Yeah.
Right? And I do love it. So, we just went through an election period where you had political ad after political ad after political ad. And then about a month before October 15th, which is open enrollment for Medicare, all of a sudden came the Medicare commercials where you got Joe Namath, J.J. Walker, you have Joe Montana, you have all these people endorsing a particular Medicare. So you don't choose your Medicare because your favorite quarterback or your favorite actor or whatever is endorsing the product. And I mean, it's ridiculous. Otherwise, be doing a reverse mortgages with Tom Selleck or something along those lines.
I mean, come on. Joe Montana, though, is one of the greatest quarterbacks ever.
Sure.
And if he says so,
you got to do it. No.
Outside of that.
But now it's Patrick Mahomes or Josh Allen or whoever it may be, whoever your favorite quarterback is. But you don't buy their Medicare. They're being paid to say those things. And they don't know about the Medicare. They don't know anything about it either. But so you have all this information coming to you and you're saying, okay, which one is better? Then I get people calling me up, which is great. They say, my neighbor says they have this plan and I think I want that same plan. I said, really? They go, yeah, I want that same plan. I said, do you wear your neighbor's shoes? Well, no.
Why would I?
well, why would you want the same Medicare? See, I'm a broker. That's the difference. Is I'm a Medicare broker. I represent about 8 different carriers here in Houston. My wife and I, our company. And what we have the ability to do is to compare all different plans side by side. Mm-hmm. And with that, we can find a plan that's right for the individual, not trying to muscle somebody in. If I worked for just Aetna, then I would just try to sell you a product from Aetna, and that's all I'd try to do. Or United Healthcare, or Blue Cross Blue Shield, or Cigna, or Humana, whatever it may be. I'd try to sell you one of the products off my shelf and kind of muscle you into that.
Gotcha.
But when I have 8 different plans, I don't care which plan I put you in as long as it's the right plan for you. And that's the fun part about it, too, to make sure. I have husband and wives, but I put the wife in one plan, the husband in another. They don't have to be in the same plan.
Okay.
Right? So, and what we do is we walk people through the applying for their Part A and Medicare to begin with, and helping them out applying for their Part B, making sure that they've signed up for a Social Security account. They have that all taken care of. And then we go and we talk about what their doctors are, who their primary care physician is, all their specialist doctors, where urologists, gynecologists, whoever it may be, and list all those people. And then we go through prescription drugs. And some people have 4 drugs, some people have 14 drugs. So we go through all the particular drugs and the importance of them being a tier 1, tier 2, tier 3, tier 4, tier 5 medication. Now you're confused.
Yeah, so let's back up and talk about the tiers, because there's Medicare Part A, B. Is there a C?
Well, there's a C is basically your Advantage plans. Part D is your prescription drug plan.
Okay, so is that where the different tiers come into play?
No.
Tiers is
strictly for drugs.
Okay.
All right, which is your prescription drug plan.
Okay.
And you have tiers 1 through 5.
What do the numbers mean?
Tier 1 is a generic drug.
Okay.
Okay, so it's the least expensive. You probably will never have to pay for that drug when you're on Medicare. So you have a tier 1, a tier 2, a tier 3 is right in the middle of the pack, and then you get into more of a specialty drug at tier 4 and a total brand drug at tier 5, like an Eliquis,
Gotcha.
or Trulicity, or something along those lines. People buying Ozempic, that's like a tier 5 drug right now. That drug costs $900 over, if you go without.
Not cheap.
Not cheap. But with Medicare, you can pay, and you're on Medicare, you could pay as low as $47, and the carrier pays the other amount, right? And that's at a tier 5. So it all depends. But something like Eliquis, and there's new rules that happen in 2025 as well. As a matter of fact, prior to us starting this broadcast, I got a phone call from my brother and goes, "What the hell is this?" Jesus Christ, rah, rah, rah. I said, "Slow down. I explained this to you last year." He goes, "Well, I wasn't paying attention. You're my brother." There you go.
Nobody listens to their brother.
No one listens to their
Younger
brother.
or older.
Yeah.
Or their parents.
Right. I listen to my friends' parents more than I listen to my own parents. But the rules are constantly changing. That's the other thing about what I do for a living. I'm constantly going to continuous education. I have to get recertified every single year and spend 28 hours recertifying myself going into the next plan year too. So that's where working with a broker, just me, or anybody is beneficial, because some people try to do it just by going straight through Social Security and getting it done that way. But it's a bear to do it that way.
I imagine it is. Yeah. One of the things that you had talked about, because you did mention, people who are on a lot of different medications. Right. And before we started, you were talking about the great thing about Medicare is that there's a big focus on preventative medicine, preventative care. And so there are ways that they can track you, not in a creepy government way, even though we are talking about Medicare, but ways that they can sort of help yourself in your golden years so that you're not having to worry about catastrophic care. Because ideally, if we're going to live to the age of 90, 95, 100, I want to live till I'm at least 105.
There you go.
But I want to live 105 fantastic years.
Yeah.
I don't want to be bedridden. I don't want to be in a wheelchair.
Exactly like this.
I want to run with the bulls.
Come on over.
Right?
I'll still be doing it.
So let's talk about preventative care with Medicare and how they're helping people achieve that.
Yeah, so Medicare, this is not your father's or mother's Medicare, certainly not mine. People are working past the age of 65 for numerous reasons. One is they may not have saved enough, or college education has gotten so ridiculously expensive they have to continue to work, whatever that may be. And by the way, I'm going to live to 126.
You got me beat, man.
Or die trying.
Yeah. It's possible in this age, man.
Well, with AI and medicine, It's going crazy. I mean, we used to say that things would increase every 6 months. It's going to be every 6 weeks now. I mean, it's just going crazy.
And we are there.
So with that, people are working past the age of 65, and people are enjoying their life. The golden years, those years that, we think about with the Golden Girls or something that our parents went through, that was happening at the age of 65 for them. That's going to happen at the age of 75, 80, 85 for us. Mm-hmm. And even for the younger generations, it might be at the age of 90 would be their golden years. So what do? Medicare right now is very, very focused on having everybody doing preventive maintenance. They want you, they have the thing called silver sneakers. They want you to go to the gym. They want you to work out. You get points for working out. They want you to walk. They want you to meditate. They want you to lift weights as you get older to keep your bones and muscles strong and keep your frame right. Mm-hmm. They avoid pains in your abdomen and your back, your knees, and so forth just by working out. Someone says, "I don't work out anymore because I got old."
Ooh.
Well, no, the statement is you got old because you stopped working out.
Yeah.
I mean, think about that.
Yeah.
All of a sudden, you don't have the muscle to hold up your framework, so you're starting to hunch, and then everything gets out of whack. Your hips hurt, your knees hurt, your ankles hurt. It's because you're just not taking care of yourself. So Medicare is doing everything it can to help you with preventive maintenance. my particular plan, they call me and do a home survey on me, just making sure I'm doing okay and so forth. And it's kind of fun to have that type of conversation. My PCP, we talk on the phone, no problem. It's all, like I said, it's all about getting you. They don't want to do catastrophic surgery. They don't want to spend, $80, $90, $200,000 on open heart surgery. They want to catch that berm or that AFib early and get it taken care of early. You go see your PCP, your primary care physician, and they'll say, okay, let's do some blood work. Maybe, see what's going on here. Let's see what's going on with your diet. Let's see what's going on with your workout activities, and what are you doing to help yourself there, and get you on a plan that's going to help elongate your life, just make you live a little bit longer with dignity.
Yes.
That's the thing too.
Right.
That's the whole thing about Medicare.
This is one that I've thought about for, I would say about the past maybe 10, 12 years. And it's that Medicare and other, what people call, I don't like the term entitlement programs, because we are paying our tax money into these programs, but they're entitlement programs. That's what we call them. Medicare, all the Social Security, Medicaid, they're going to be insolvent. You talk about the dozens of trillions of dollars in debt, unfunded liabilities, yada, 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 yada. What do you tell somebody who is my age, 49 going on 50, who thinks, Medicare ain't going to be there for me, Jack? Why do I even care?
Well, because you don't know that.
Okay.
You just don't know that. I got a note today because the government stopped doing some funding, and they said, we're not going to pay for anything. We're just stopping the payments right now until we figure out what's being paid out with, money's going to the Gaza and this and some Ukraine. And where's all this money going, and why is it going there? What was it? They said they're sending $50 million worth of condoms to the Gaza Strip.
I heard that one. That's wild.
Yeah. I would think they would not want to use condoms, that they need to repopulate. So, I don't know. Yeah. But anyway, so there's too many people, too many lives at stake right now, for them to say that, a broad sweeping statement like that. And people are too used to. I don't know how they would slow that down, or what they would do to change that, and how they'd make that happen at this point. I would just continue marching ahead, thinking that it's going to be there for me, right? But no one wants to sit there and rely on Social Security as a retirement fund anyway. It's not going to be enough anyway. Right. Right. So you need to be doing your own saving, getting yourself all prepped up for yourself.
See, that's what I was thinking, is that the doom and gloom part of me is like, $36 trillion in debt, I don't think it's going to be anywhere, right? Yeah. But then the more rational part of me is like, well, you know what? It's going to be there in some way, shape, or form. It might not be what I thought it was going to be when I was in my 30s and 40s, but when I turned my late 60s, Medicare age, it just won't be there as much. And so the onus is on me and everybody my age, and people in their, that are in their early 60s going on Medicare, that are soon to be going on Medicare, that the onus is on us to start really planning for that future, getting into that preventative care mode.
Right.
And taking care of the financial house. That way, if it's not there as much as we thought or had hoped, then there's some kind of buffer there, I guess.
Yeah, you got something else to hang on to, for sure. And I wish I had the crystal ball. I wish I could tell you. If I had the crystal ball, I'd be hanging out with Bezos, and
you wouldn't be here.
No, of course I would be. I'd be talking to you. You got a great show.
Oh man! But I'd like to ask you just one more thing. What do you tell somebody who's calling you, and they're maybe not so much concerned that Medicare's not going to be there, but what is your advice for new patients who they're just overwhelmed with information?
Sure.
Whatever.
Well, first of all, you can go to our website. It's www.remingtonbrokers.com. So it's Remington, brokers with an S.com. You can send in information, you request a phone call from us or whatever. We can sit there and talk to you about what your needs are. All our consulting is free. We do everything for free. And we don't get paid by you. We get paid by the carriers. So again, when I was going back with the 8 different carriers that I have, each carrier pays me the same amount of money for a new patient, a new client. So again, it doesn't matter. I don't have a bonus plan. I don't have anything like that. Again, I just find the right plan for the individual. But I'll talk to you until you're blue in the face, or your ears are bleeding or whatever, about what the process is that you need to go through and how you have to go through it. And boom, that's it. So you can do that, or you can get information off of the website. You can go to ssa.gov, G-O-V, that's the Social Security Administration.gov, and they have information on Medicare there, which, you'll look at that for about 3 or 4 minutes, and you'll go to www.remingtonandbrokers.com and talk to me and get it figured out.
Yeah, those guys don't make anything easy for any of us, do they?
No, I was on hold. So I have a client trying to figure something out. I said, don't worry, I'll take care of it. And I called Social Security. I was on hold for an hour and 8 minutes.
Oh, that's it?
That's it. And then I had to hang up. I never spoke to him.
Jeez.
Never spoke to him.
Doesn't surprise me.
Yeah, but that's part of the deal. But the main thing is that, always take care of yourself.
Yeah.
You're the best person to take care of yourself. In my book, Be a Holic, the 14-step process to become a successaholic, I talk about health. And I say, the acronym is SEE, myself to health. And it stands for sleep. Make sure you're getting plenty of good sleep. That's 6 to 8 hours worth of sleep, depending on who you are. You E for exercise, and make sure you're getting out there and just walking every single day, whether it be a mile, and if you get into 3 miles or do whatever, walking is going to be good for you. And if you can get to the gym and lift weights and do things like that, or buy some bands that you could do at home, all those things are good for you. And then the other E is for eating, and make sure you're eating healthy. I mean, if you look at the back of the box of a food and all the processes that's going through that food,
Mm-hmm.
if there's more than 5 things on that label, then it's putting chemicals into your body.
Yep.
Right?
Yep.
So we'll see what RFK has to say about that, and, wherever that goes. But you got to SEE yourself to health and be part of the solution. You got to be a willing participant in your own rescue when it comes to your health and to your Medicare. I'll be 100% of your help when it comes to Medicare whenever you want me to do that for you.
Fantastic. Peter, thank you so much for being on the show.
Well, thank you for having me, and congratulations. Which number show you're up to? I don't know. How many gazillion shows?
Well, this is the third since leaving radio, so only 3 shows.
No.
Yeah.
No.
Yeah.
3 titles.
3 titles. Over 100 episodes?
There you go.
Okay, episodes. Yes.
My bad. All right, congratulations.
Thank you, sir.
All right, thank you.